I extend a warm welcome to all the people who are joining us in the special webinar number 146, organized by the Andean Health Organization Hipólito Unanue Agreement. This cycle of webinars began in May 2020.
Nos encontramos celebrando
This year we are celebrating 50 years of the Horas Conhu, a very sensitive and significant anniversary due to the difficult time we're going through. However, as a reference in health in the region, we continue uninterruptedly with joint and coordinated actions with the 6 member countries: Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela, thus fulfilling the goals and objectives to strengthen the health of our people.
como referente en
As
salud,
a reference in health, we highlight 3 aspects: contribute to reduce the vaccination gaps, especially in view of the alarming situation regarding the re-emergence of polio cases in the world. We urgently need to reinforce immunization campaigns so that the population can adequately comply with the vaccination schedule in each of their countries.
el contexto
The
socioeconómico
socioeconomic and environmental context in Latin America and the Caribbean is a scenario in which hunger, food insecurity, and malnutrition have increased.
se requieren
Political decisions are required to achieve sustainable, sufficient, inclusive, and efficient agri-food systems
generadores de
that
igualdad,
generate equal access to a healthy diet for all.
el cambio climático.
Climate change threatens life, health, and well-being. However, we can contribute to its preservation from wherever we are, generating social policies and a sustainable development model. By joining an initiative in defense of the environment, by buying local products and plant-based foods, we can use public transport, cycling, or walking, as well as reducing consumption by reusing, repairing, and recycling. It is everyone's duty to restore a relationship with nature. It is necessary to recognize the ancestral knowledge of the native peoples who have lived in balance with Mother Earth and practice good living. Well, in accordance with what has been said today, Tuesday, October 25, we open our virtual doors to discuss a topic of great importance for our region: caring for vision from childhood, prevention of low vision and blindness with a life course approach. We invite you to leave your name, organization, and country from which you're joining us through the comment box of the Facebook Live or YouTube Live chat. In that same space, you can leave your questions or send them via email to webinarhorasconju@gmail.com. To access the certificate of attendance to this webinar, as usual, you must fill out a short survey and leave your data in the fixed link found in the Facebook Live or YouTube Live chat. The certificate will be sent to you to your email in the next few days. This webinar will be developed with the usual dynamics. We will start with the institutional greeting, then the presentations of our speakers, the active and the space for Q&A. To begin this important day, I give the floor to Dr. María del Carmen Calle, Executive Secretary of the Horas Conhu, who will give the welcome and the institutional greeting. Go ahead, Dr. Calle.
Magda.
Thank you very much, Magda. Good afternoon, good morning, good evening. Welcome to all participants, and especially the distinguished speakers who are with us today.
Como saben
As you
ustedes,
know, the Andean Health Organization Hipólito Unanue Agreement has completed 50 years of uninterrupted work in December of 2021 in favor of the health and welfare of the population of our 6 countries. We are talking about Bolivia, Colombia, Chile, Ecuador, Peru, and Venezuela, which means more than 167 million people in the area of these countries. First of all, thank you so much.
Martes 25 de octubre, en este
Well,
webinar,
in this webinar, special webinar,
desde que el Horas CONU
since the Horas Conus
2020 este ciclo.
2020 started this cycle. Today, we have considered of great importance in the frame of the celebrations carried out every year by the World Day of Vision that is celebrating according to the World Health Organization, second Thursday of October, and this year was celebrated on the 13th of this month to listen to important professionals from the World Health Organization in Geneva, the Pan American Health Organization in Washington, D.C., and the Pan American Health Organization Brazil regarding visual health in childhood, and whose objective is to raise awareness and to inform about the different types of visual diseases and conditions, the treatments that exist, and the ways to prevent them early under the life course approach. Visual disturbances affect the entire life course in children and small children. Visual disturbances may cause delays in motor, language, emotional, social, and cognitive development with lifelong consequences, as well as presenting a lower academic achievement worldwide. The increasing prevalence in myopia is of concern, especially that related to the way of life among children, in particular, the intensive use of near vision and the little time devoted to outdoor recreation. A significant number of visual health alterations are preventable. Infections, trauma, perinatal diseases,
enfermedades relacionadas con
perinatal diseases, nutrition-related diseases, unsafe use or self-administration of topical treatments. But this is not the case in all cases. Therefore, each diagnosis requires different and adequate responses. And this implies a challenge for visual health professionals to approach each person in a comprehensive manner, involving actions ranging from promotion, prevention, diagnosis, or treatment according to each case. In Latin America, it has been shown that the highest prevalence of blindness and visual impairment is concentrated in the poorest areas, related to inequities in the distribution of eye health services and the distribution and availability of ophthalmologists, among other factors. On the other hand, the COVID-19 pandemic has originated important changes in the health supply and demand, being notorious the decrease in the offer of prevention and treatment services for several diseases. Among them, the ophthalmology services because they were reorganized or suspended due to the prioritization of infrastructure and human resources toward the care for the COVID-19 patient. On the other hand, due to the fear of infection and the periods of confinement and social isolation, the population has not demanded attention to their eye problems, being relegated, with the consequent risk of complications. This situation invites us to rethink and strengthen the strategies developed to date, moving towards a multidisciplinary and intersectorial work, with a focus on the exercise of rights and life course to combat the prevalent ocular pathologies of the population of the Andean region from birth and thus contribute to the health and welfare of our people. Faced with the wearing reality of eye health in our population, especially in interventions from childhood, the Andean Health Organization Hipólito Unanue Agreement, or ASCONU, and the ministers of the Ministries of Health of the 6 Andean countries have prioritized important actions such as the determination of the current situation, the recognition of the interventions that are being deployed, and the resources available in the Andean countries. That will make it possible to organize in the medium and long term an applicable and sustainable joint response in policies and multi-sectoral alliances on the risk factors and socioeconomic and economic determinants mostly, as well as to achieve health systems prepared to respond to the demands of the population in order to reduce disability due to these pathologies, improve the quality of life, and have timely and quality information. Once again, welcome to our participants, and thank you for your presence and interest in what we will share with you today.
Muchas gracias, doctora
Thank you, Dr. Calle.
Luego del saludo de nuestra
After the greeting of our Executive Secretary, I introduce myself. My name is Magda Hinojosa, the physician, life course coordinator of Horas Conju, and I am pleased to be in charge of moderating this webinar. On this occasion, we will be joined by leading professionals and researchers from the World Health Organization and the Pan American Health Organization, who have extensive experience in the subject that brings us together. After this preamble, we will begin this event by presenting our first speaker with this topic, the state of the eye health in Latin America and the Caribbean, epidemiology and etiological factors of childhood ocular pathology. And we welcome Dr. Carolina Holmes, who has 23 years of experience, 12 years working as a professional in public health, and 11 years as a doctor in dentistry. In 2014, Carolina joined the Pan American Health Organization with the oral health program, and since then she has served in different roles. In 2015, she joined the Healthy Life Course Unit in the Department of Family Health Promotion and Healthy Life Course of PAHO as a Healthy Life Course Specialist. And since 2021, she has been working as a Life Course Advisor with integrated approach. Welcome, dear Dr. Carolina Holmes. The space is yours. Go ahead. Thank you very much, Magda.
Comparto la
I'm going to share my presentation.
¿Puedes ver bien mi presentación?
Can you see my slides? Yes.
Gracias.
Great. Thank you.
Bueno, entonces como
So,
muchísimas gracias por la
thank you so much for the invitation. It's an honor for me sharing this platform with all of you and my colleagues from WHO and PAHO. My presentation as Magda will be on the state of eye health in Latin America and the Caribbean in the children. The content of my presentation includes definition of visual health, the Latin American Caribbean, the visual situation. We'll look at the most significant events in visual health, including the World Report on Vision, the resolutions on the last two World Health Assemblies, what we understand by the design of intervention and models centered on the person in the context of universal health, the perspective of life course in visual health, and I will talk about the intervention package from WHO for vision health that will be explained in more detail by my colleague, Dr. Mueller, and I will finish talking about the importance of the integration and existing opportunities to advance and elevate the significance of vision health in universal health.
La comisión del Lancet,
The Lancet Global Health Commission in 2020's paper make a call to the adoption of a new definition of visual health in order to promote the rights of the people with visual disability to improve their functional capacity by increasing access to these visual rehabilitation services and creating more friendly environments by strengthening the policies and laws that were more inclusive to guarantee that sight rehabilitation will be considered as a comprehensive component of the ophthalmologic services to reach universal health. So it has been defined as a state in which vision, eye health, and functional ability are maximized, thus contributing to overall health and well-being, social inclusion, and quality of life. This definition is very important because throughout the course of our lives, vision plays a fundamental role in the development. Since we're born until we become adults, the ability to see affects how we perceive, interpret, and communicate with the world around us.
Un bebé depende de
A
la
baby depends on his or her vision to recognize his mother or father. A small child uses vision when they are learning to walk and to keep their balance. In school, vision is very important for learning. And more ahead in their life course, it will be to maintain functional capacity and independence in a world that is constantly changing. In general, for most of us, vision is part of daily communication, social activities, educational activities, and professional activities, care of others, and health maintenance and independence and personal motility. Latin America and the Caribbean is a region in transition. Well, there's still a big gap in health. This is very important because although people are living more, this not necessarily those years gained are not translating in years gained with good health. So the current gap between life expectancy and healthy life expectancy is approximately 11 years. 11 years with functional limitations and disability. Although this visual disability and blindness affects quality of life, we don't think that it affects life expectancy. However, in a publication from the Lancet of last year, it was reported that people with poor visual health had 2.6 times higher mortality risk. Vision impairment causes or exacerbates other conditions, either directly with traffic accidents or indirectly through the reduction of the access to health care or the limitations in physical activity or an increase in social isolation. And of course, in children, it has a negative effects on school performance. In this graph that you see, we see the common causes that produce the loss of productive years due to visual disability in the old people. This gives an approximation of the incidence and the severity of the different conditions and the mean time that the person is going to be affected. That is why it is very important to have an early detection of visual deficiencies and the timely correction. From this data, we can see that the highest burden of disability comes from sensory deficiencies in low and mid-income countries. Unfortunately, and despite that we have had several progress in this field, visual deficiency are extended and our countries are frequently are untreated, and the disease burden is not distributed. It has heavier weight in low and mid income, in the elderly, and in rural communities. Despite all these improvements resulting by Vision 2020 initiative, we know that it was not possible to achieve the goal of eliminating avoidable blindness for 2020 in Latin America. COVID came into our way and also made this the achievement of this goal be even more delayed. Now we know, following these papers by experts, although cataracts, refractive errors, and screening of ROP, it may be that in a few years, diabetic retinopathy, glaucoma, and macular degeneration may come to the fore while our populations increase their uh, age and more effective treatment of other diseases. Cataracts, trachoma, onchocercosis, and refraction errors are a priority for WHO. In Latin America and the Caribbean, the second priority of PAHO for adults is diabetic retinopathy, glaucoma being the third, and for children, the retinopathy of prematurity and refractive errors. This is based on what evidence has shown. There are still many gaps to be filled, mainly in countries where we have limited or no epidemiological data on blindness and visual impairment. Today, we don't know the real economic cost of blindness and visual disability in Latin America. Here I've included an article where Dr. Furtado, my colleague from PAHO, and Dr. Silva published some time ago. And this article, they indicated that they use a very simple example based on the salary loss, were estimated that annual economic losses for the region at that moment range from 8 to 29 billion dollars. And these numbers didn't include the cost of care or the payments for disability or the economic losses in the family and other significant variables. Among children, the leading causes of blindness and moderate and severe visual impairment include uncorrected refractive errors, cataracts, retinopathy of prematurity, congenital ocular anomalies, corneal scarring, and cerebral visual impairment. There are also many conditions that cause pronounced symptoms, such as pain, itching, discharge, and affect a large number of people without vision problems. These include, just to give you a few examples, infectious and allergic conjunctivitis, blepharitis, and dry eyes. We need to approach this morbidity, the resulting morbidity, which forms a substantial proportion of the work in the ophthalmic service. Public health approach may prevent or treat ocular diseases. However, the visual loss and access to ocular care are affected by social determinants, which just to mention some social inclusion, gender inequality, the development in the first infancy, and the lack of education, the employment, the design and implementation of health systems, and available public health programs. This chart that I always share in my presentation is part of the Lancet paper, and I did some modifications. I include the perspective of life course in visual health because we from PAHO consider visual health as an indispensable asset to improve visual characteristics of populations, especially during the critical periods of development and throughout the entire life. In the socioeconomic context in which a child is born and lives, is going to have deep, profound effects on visual health throughout the course of life. Nutrition in the early ages, immunizations, intrauterine infections such as rubella, toxoplasma, and syphilis, and other diseases are important determinants in their development. The early birth, ROP, low birth weight, the use of tobacco by the mother during pregnancy, the alcohol abuse may cause problems in the vision and disability in these children. Congenital visual conditions may have genetic components. The biological determinants and social determinants and environmental determinants interact to determine the visual function and the trajectory course in terms of health. In the life course of an individual, we know that there are critical periods and very sensitive that are considered as this window of opportunity to do a timely intervention and protect these health trajectories that will guarantee this gain in visual capacity or prevent its loss at different moments in the course of life of a person, especially in these important stages of development. The accumulation of risk factors throughout life, in particular during the critical and sensitive period of visual development, influence in the visual trajectory. In this chart, this is quite evident. It gives us like a snapshot of the importance of timely interventions at any moment in life of an individual for visual function. The visual loss because of the retinopathy of prematurity or ROP is characterized by the abnormal development of the blood vessels that can be prevented to a large extent by timely interventions. The risk factors include the increase of prematurity, supplementary oxygen inadequately administered, low birth weight, and sepsis. The investigation on the ROP in Latin America and the Caribbean started 2 decades ago and tells us that the disease is a major problem in the region where 2/3 of the annual global cases of blindness caused by ROP. So the ROP is the leading cause of preventable childhood blindness in Latin America. According to the study that you can see in the slide, where several countries participated, where we have Dr. Silva is one of the authors, that despite that ROP has become a major cause of visual impairment and blindness in the region, most previous research have focused on the incidence and or treatment of ROP in a center rather than a national or regional level. The study showed a large disparity between countries in terms of coverage of ROP legislation and the national systems of data collections used for ROP monitoring. Only 2 countries had all 4 indicators of government input at the national level of ROP included in the study, which tells a extreme disparity in the participation at the national level and coverage and follow-up nationwide in this region. The surveys from the previous slides were completed by 11 experts from 10 countries in Latin America and the Caribbean, including Argentina, Brazil, Colombia, Costa Rica, Cuba, Dominican Republic, El Salvador, Mexico, Nicaragua, and Panama. So according to the results of the survey, 6 countries had a national policy that include prevention, detection, and treatment of ROP, with the costs of detection and treatment are covered by government policy and or health insurance. 8 countries had national guidelines for ROP, 4 had legislation requiring eye examination of premature infants, and most countries had neonatal intensive care of level 3 and 4 with ROP programs in the public sector. 5 countries had a system of data collection and monitoring system to track number of newborns, infants screened in hospital settings. So although the results of this study showed a positive relation between the inputs of ROP at a national level and the detection of these eligible ROP, only 10 countries of the 43 eligible countries in Latin America and the Caribbean were included in the study. So the authors highlight that there is a need for more research by looking at the difference in the region, in the policies, in the legislation, in the guidelines that exist with monitoring of ROP, treatment of ROP, and above all, we need a level of participation and action at the national level in terms of ROP. The authors also recommended in this article to strengthen the interventions and the politics program in clinical areas, given the positive correlation between national policies and the proportion of eligible newborns for evaluation for ROP. So countries with 3 or 4 of the elements included or mentioned previously evaluated almost 95% of the newborns eligibles in that year, 2014, while those with only 1 or 2 elements evaluated 35% of the eligible newborns. Blindness control by ROP has been a regional priority since the 90s, where the ROP was identified as an important cause of blindness in children, and this was included in the Pan American Health Organization Action Plans for Prevention of Blindness of 2009 to 2013 and 2014 to 2019. Here, the Ministry of Health in the region approved these plans that were implemented with support from Pan American Health Organization, the International Agency for Blindness Prevention, international NGOs, global experts, and the Pan American Society of ROP. In 2017, PAHO worked with an international multidisciplinary team to develop these guidelines, evidence-based guidelines, so ROP will be a regional standard or as a guideline to eliminate this problem. 9 of the 19 countries collected data, sent the information that was requested in this survey. In Chile and Argentina collected data on a systematic way since that time. In Chile, the program is still being implanted in all regions and in 8 provinces. The image screening with telemedicine that is read by ophthalmologists has proven to be effective. In Argentina, according to the 2018 study, 114 neonatal intensive care units, which most of them are public, 119 ophthalmologists implemented this screening and treatment in all the provinces in Argentina. More than 60% of these provinces, for example, Bolivia, Costa Rica, Nicaragua, have at least one neonatal intensive care unit that carry out this screening is approximately half of the provinces in the region of Paraguay, Peru, El Salvador, and Guatemala have less than 50% of these provinces that have implemented this type of program. So in Latin America has experienced a strong regional leadership, advocacy, and support from international partners and experts. The ministries of health are introducing protocols and regulations and making significant financial allocations for the incorporation of all ROP services in neonatal care. Almost half of the countries have an inventory on the amount of NICUs and ophthalmologists that implement a program of ROP at the national level and are using telemedicine for screening. Argentina and Chile have a national committee that plans and does implementation of activities to strengthen services and human resources to cover all these national regions and collect and screen and use the data that they collect. Uncorrected refractive errors are one of the leading causes of blindness and visual impairment in the world. Refractive error, mainly associated with myopia, is one of the main causes of reduced vision in school-age children. As Mari Carmen mentioned, correctable visual impairment has been associated with social factors, available services, and various individual barriers that include the lack of follow-up with vision screening at school level. It's associated with parents and children's perception of vision problems, peer pressure, and concern for the safety of the glasses, even when they are provided free of charge. So it's very important to recognize and use the achievements in eye care in recent decades, but we still have many challenges and require a lot of effort, and this is highlighted by the World Vision Report, which indicates to build and expand the care model based on integrated person-centered eye care, to improve the delivery of quality eye care, improving through primary health care, to improve health information system for eye care, strengthening the capacity of personnel working in the field of ophthalmology. The health systems are facing major challenges to satisfy the current needs of ocular care. And as public health specialists, we have a responsibility to provide solutions that can overcome these problems. The information of the world is that eye care, integrated person-centered eye care, can accelerate this change. So for this to become reality, the recommendations of the committee are the following. Eye care is an essential part of universal health. Implement integrated person-centered eye care. Promote high-quality implementation and research in health systems in order to complete this empiric base of empiric care in ocular care. Promote the track trends and assess progress towards implementation of integrated person-centered eye care, and to raise awareness, engage and empower individuals and communities regarding eye care needs. So in this regard, as you know, in 2020, in the Third World Assembly, the 173 Assembly, recommended member states about the achievable goals targets for 2030 about people-centered integrated eye care, focusing on effective coverage of refractive errors and cataract surgery. The proposal for this global objective for the effective treatment of refractive errors, an increase of 40 percentage points in effective refractive error coverage by 2030. In countries with an effective coverage of 60%
o superior
or
deberían
higher
deberán
should
implementarse para alcanzar
reinforce to
la cobertura
increase
universal. Y para la
universal
cobertura
coverage,
universal
and for the
de
effective
cataratas,
coverage of cataract
el
surgery,
propósito es
30
lograr la
percentage points
perspectiva de las cirugías
increase
cataratas para el 2030.
for 2030.
Las razones de por qué entonces
Why
se
cataracts and refractive errors were
las
selected
errores de refracción en estas metas incluyen
for these goals include that these are the main causes of visual impairment and blindness, common eye conditions that lead to seeking care.
Se espera que aumente el
We
número
expected that
absoluto
the
de
absolute
personas que viven
number
con
of
estas
people living with
condiciones
these conditions is
y
expected to
beneficiarán
rise.
de su
They serve as proxy
acceso
indicator
a servicios de
of
salud
coverage and
pública.
quality of health services in eye
La
care,
cirugía de
and the
cataratas
provision of
es
eyeglasses and cataract surgery are highly effective interventions.
Cuando hablamos entonces de
When we
diseñar
talk about the design of
y esto es un punto muy
person-centered models and interventions, we need to consider that we should
en
put
el
the
centro.
person in the
Y
center.
esto no es lo mismo que
And this
poner
is
al
not the
paciente
same
en el
that to put
centro.
it in the center
Cuando
of the
hablamos de
disease.
atención
When
centrada
we
en la
talk
persona,
about
consideramos tanto a la
patient-centered care,
persona como
we
el
consider
hospital
this person as
y
the
los procesos.
core
Por
axis
tanto,
of
la
the plans
diseñación que
and the
diseñamos
interventions that we
realmente el
design.
enfoque en la persona implica
And
también un
the
enfoque en el tiempo
person-centered approach
que va a tener el
implies an
conocimiento
approach in
y
time
las
based on
competencias
knowledge of that
características
person and the
con
characteristics
intervención especial
in a special
basada
context
precisamente
that
en el
accumulates in time and is
de los
not
episodios
specific
asociados al
of the
tratamiento.
people of
El
the
Informe Mundial sobre la
disease.
Visión hace
The World
énfasis en
Report
este
on
enfoque
Vision has
y es un
emphasized
documento que
this, and this is
estimula
a
que los
document that stimulates
pacientes
action
le hagan
in
frente
countries so they
a
can
estos retos
face
que,
these
que, que, que tenemos, promoviendo
challenges
la
that we
calidad
have
de
ahead,
vida
proposing
integral.
eye care,
Se estima
comprehensive eye care,
como estrategia
person-centered as a
para establecer los
strategy
sistemas de
to
salud
strengthen health
que sean
systems
capaces de una prestación de
and have
servicios
the
que
basis
atienda las
of
necesidades de la
health
población.
services that takes care of the
La atención
population
integral,
needs.
integrada y centrada en la persona, entonces
The
consiste en estos servicios de salud
person-centered
popular
in
que gestionan y
care and
prestan para
person-centered
asegurar
care
un proceso continuo de
is going to
intervención
assure a
desde la
continuous
prevención, la
uh,
prevención, el tratamiento y
interventions,
rehabilitación y
which
gestión
prevention,
integral
treatment, and
dentro y fuera
rehabilitation
de la
that should be
prisión,
coordinated among the
dentro y
different
fuera del
sectors
sector de la salud y en
in
función
and
de las
outside the
necesidades
health sector
de
and
los
according to the
usuarios de
needs
los
of the
servicios.
people throughout the
La
course of
atención
life.
integral, integrada y centrada en la persona
Comprehensive and
contribuirá entonces a
person-centered
garantizar
eye care
la
can
salud
contribute
universal
to
y
achieve
de los
universal health
objetivos
and is
de
aligned
desarrollo sostenible número
with
3,
the
que es
SDG number
garantizar
3, which is to
una vida
guarantee
sana y
a
promover el
healthy
bienestar
life and
de todos
promote
a
well-being
todas las
of
edades.
everyone at every
En noviembre
age.
del 2020,
In November
la
of
Asamblea Mundial de la
2020,
Salud,
the World Health
la
Assembly,
Asamblea Mundial de la Salud, los Estados miembros
the
de la OMS
member
aprobaron
states of
esta
Pan
resolución
American Health
número
adopted
73
this
y
resolution
se le
number
pidió
73
entonces a la
that
OMS que desarrolle
ask
un
the
protocolo
WHO to develop guidance
y
on
esta metodología
cost-effective, evidence-based
costo-beneficio
eye care
basado
interventions
para
and approaches
facilitar
to
la
facilitate the
integración
integration of
para
eye care
todos
into universal health coverage.
respondiendo a la solicitud, la
To
OMS,
this end,
a través de una
WHO,
resolución
through
específica
consultations with
en
international
septiembre,
experts,
desarrolló el protocolo
developed
de
the
intervenciones
eye
para
care
evitar
intervention
riesgos
package
que proporciona
that
información sobre
provides
intervenciones de
information
atención
about
oftalmológica
interventions of
basadas en evidencia
ophthalmologic care
y
database
los recursos
on
necesarios para su
evidence and the
implementación.
resources
Entonces,
needed for the
este recurso
implementation.
sirve para
So
facilitar
this
a los
resource
responsables de la formulación
facilitates
de políticas
those responsible for formulating
de
policies
investigaciones técnicas, la
and the
integración de la
technical
atención
decisions,
oftalmológica
the
en los
integration of
PCS
ophthalmologic care
y
in
los
this
servicios de
package
salud,
and policies of national health services,
como mencionará
as
el doctor Müller en su
Dr. Mueller will mention during his
el paquete
presentation.
de intervenciones,
The
entonces,
intervention
la
package,
calidad de los
therefore,
ojos es un
for eye
recurso
care is a
fundamental para
extremely
los
useful
países
resource for the
que les
countries.
va a permitir
It will
priorizar o definir qué
facilitate what
intervenciones siguen y
interventions
presupuestan e integran
the
el
budget
continuo de la
in the
atención
continuum
oftalmológica
of
y de
ophthalmologic
las formas
care
de la prestación de
and all the
servicios.
platforms of
Además, es parte integral del
health care
compromiso
and
de
is
la salud
part of the
universal
comprehensive care
de
of
la
universal
OMS.
care from WHO.
Aquí este
Here,
paquete hace
this
recomendaciones de
package
intervenciones en varias áreas y
recommends
contextualiza
intervention in
intervenciones
several
en las
areas,
áreas de promoción y
in the areas
educación,
of promotion and
tanto a
education,
nivel individual como
both at the individual as well
a
as
nivel individual,
in
ya sea por profesionales
either
en
by
práctica
health professionals
clínica
during
individual
clinical
o a
practices
nivel de
or
población en campañas de
through the
salud pública.
population in
Entonces se
public health
recomienda que
campaigns.
en el
They
primer caso,
recommend
a nivel
in the first
individual, la
case and the
educación y la
individual case,
promoción de la salud ocular se
the
centren
health
en todos los niveles de
education is
atención,
provided at the
tanto
levels
en la
of care with an
promoción de la educación
emphasis
y el
on
asesoramiento
education
simple,
and
efectivo a nivel
counseling.
comunitario y de
It is
desarrollo
effective at the
de la región.
community level with primary care.
Respecto al segundo,
With regards
a
to the
nivel de
second one,
población,
at the
se
population level,
recomiendan algunas áreas de
although
educación y
some
promoción de la salud
areas
ocular pueden
of
entregarse en campañas educativas
and carry out education campaigns. There's a large number of opportunities to integrate education on the eye care in other areas of health, such as occupational health, nutrition, or immunization, to mention a few. The approach and the promotion strategies for education and prevention in ocular health should complement to the clinical interventions, the existing policies, and to create awareness in the countries. Due to a large variety of factors that affect visual disability can be missed, and it can have severe consequences if not treated on a timely basis. Therefore, the importance of screening in children, adolescents, and older adults. Due to an increase in the number of premature births and survival of the premature babies, ROP has become one of the main causes of blindness in many countries of mid-incomes. The importance of visual health in learning and the frequency of refraction errors in children in preschool age and school age, and the eye exam in school age, followed by the correction and other services is important to mitigate the impact of untreated visual disability. The eye exam, the external eye with use of glasses, or the referral to be seen in the services of school health implies the interaction with professionals, and this requires the cooperation between the Ministry of Health and Education Ministry. In some ocular conditions, such as diabetic retinopathy, is not diagnosed because it may be asymptomatic in the early stages. It is important to implement specific detection measures for the early diagnosis of these ocular conditions in the high risk populations and visual discapacity in key areas on the course of life, and the detection of pediatric congenital eye conditions followed by appropriate interventions, including surgery, are effective to guarantee that these children who are born with congenital eyes, such as congenital cataracts or retinoblastoma or congenital cataracts, will not experience the adverse effects associated with these late eye diseases, and their visual development is going to be affected. So to achieve the integration and continuity of care is a strategic priority at the global and regional level. The need for social care throughout the life course should be approached in an integrated and continuity of care. The objective of coverage and universal access to health is to guarantee that every person have access to this promotion, prevention, care, and rehabilitation services that they need when and where they need it, without exposing to financial difficulties. It is crucial to promote, therefore, integrating strategies that combine individual approaches and combine population approaches, and include integration as an axis of interventions to optimize health, both individual or the population, where all these care levels are integrated in special disciplines and medical specialties. They should also promote coordination between different sectors, the ones that the health system cannot deal. So the influence of the health determinants and incorporate other sectors in their effort. This requires the design of models and interventions that go beyond of preventing or treating the disease, and to increase this concept that health as a resource that needs to be built and is absolutely necessary for the development of individual and populations and communities,
socioeconómico de la
for the
sociedad.
socioeconomic development of the societies and in visual health. This is clear. Interventions and tools already developed by a multidisciplinary group for the management of conditions such as ROP have allowed these children to continue their visual development, as well as reducing the prevalence of preventable blindness. There are clear efforts in the countries that are included in these articles and the evidence that's constantly generated focus to reduce visual disabilities through detection and treatment of refractive errors in school-age children. We also have the toolbox of WHO myopia R. This set of tools that includes a number of messages based on evidence for key groups of users that are formatted to deliver text messages together with operational and resource to implement and monitor this initiative. All these programs and interventions should provide a comprehensive health center in the person that promotes this development of capacity, growth and well-being, the construction of resilience, minimizing this vulnerability and the accumulated experience of the risk factors. And to conclude, the opportunities to act and promote visual health as development, we have been related in the policies and resolutions that have been previously mentioned. United Nations Resolution Vision for All offers an important opportunity to identify the work toward the care of eyes and vision for all. The World Health Organization World Vision Report for the integration of the care of vision in the health systems, and that highlights the need that visual health is a central element in universal health coverage. The World Health Assembly resolution adopted in 2020, which provides a global commitment and the comprehensive people-centered eye care. People can receive these visual care services that include a complete approach to ocular conditions throughout their life course. And at the level of our countries, many efforts have been carried out, but it's important to continue with this dialogue of policy at a national level about the incorporation of visual health in all the sectors of health. And this guarantee that visual health is included in health planning at the national level, information systems, policy formulation, and the implementation at the community level. With this, I finish my presentation. I invite you to visit our webpage and WHO if you need more information. Thank you so much. Wow. We thank the intervention of Dr. Carolina Holmes, who today has told us the importance of vision as a fundamental element for development of people that allow us to enjoy of way how we perceive our surroundings, how we interpret and communicate with the world that surrounds us. We have heard the alarming situation in the region of the Americas, where the loss of vision is one of the most important causes of disability, and the disease burden is not distributed equally with heavier costs in mid and low income countries. Unfortunately, the goal to eliminate preventable blindness in 2020 was not achieved. There are still many voids to be filled, mostly in countries where we have limited epidemiological data or absent data regarding blindness and visual disability. In children, Dr. Holmes mentioned the most important causes of visual disability and blindness. We include refraction errors that are not corrected, cataracts, ROP, congenital eye anomalies, among others. She has highlighted the importance of approaching visual health with a course of life approach that goes from before birth. We have heard that ROP is the most important cause of blindness that can be preventable in Latin America. However, most of the previous research have focused in the incidence and treatment in a specific center, specialized in their focus in national or regional centers. She highlighted the need to increase research in countries and the implementation of programs to detect and manage ROP, but this is still not sufficient. On the other hand, we have refractive errors that she mentioned that are associated with myopia, which is the leading causes of visual acuity reduction in school-age children, and this is associated to social factors, available services, and several individual barriers. We have many challenges to face, such as how to build and increase the care model on a comprehensive and person-centered ocular care, and to improve the eye care with quality, and to improve the information systems for eye care, and to strengthen the capacity of the personnel that works in ophthalmology. Our systems have several challenges. Dear Dr. Carolina Holmes, we reiterate our thanks for your lecture and invite you to remain in the room. At the end, we will have a dialogue in response to questions from participants. Now to present the prevalent ocular pathology in childhood, ROP, refractive defects, amblyopia, and strabismus and retinoblastoma, early diagnosis and treatment. We welcome Dr. Joao Marcelo Furtado, who is professor of ophthalmology at the University of Sao Paulo, Ribeirão Preto, Brazil, technical advisor on sensory health for the Pan American Health Organization, technical advisor of the Lions Club Size First for Latin America. Welcome, dear Dr. Joao Marcelo Furtado. You have the floor. Go ahead.
Hola, doctora. Muchas gracias.
Hello, thank you very much. It's a pleasure and an honor for me to be with you.
Déjame compartir mi pantalla. Creo que se ve mi pantalla, ¿verdad?
You can
Perfecto.
see this screen? Yes.
Muchas gracias. Bueno, un honor.
Thank you.
Una vez más. Y
It's an honor, and I will talk about
que la doctora ha mencionado.
diseases the doctor had mentioned: blindness, visual deficit, how we do the early diagnosis and treatment with an approach of public health and an approach in life course.
Sí, esto es lo que
This is
vamos
the
a hablar
content.
de algunas
I'm going to
enfermedades
talk about some diseases, and as you can see,
especialmente en salud ocular de los
especially in children's health care, eye care, there are many things in common with other health areas.
Esta es una de las razones
This is one of the reasons why it's so important
cuidemos de la
that we
persona
take
y
care
no de
of the
las
person
enfermedades.
and not the diseases.
Cuando pensamos
When we think
ceguera y
in blindness and visual
una
impairment,
persona ciega,
or in a blind
que
person,
usualmente viene
what
a
usually comes to our
nuestras
mind
cabezas es
or heads
un adulto mayor.
is
Sí,
the
porque
elderly,
ceguera no es algo tan
because
común en la
blindness is not
población,
something that's
pero
frequent in the
cuando pasa
population,
eso,
but when this
usualmente
occurs, it is
el ciego
usually
tiene una edad más avanzada
the blind person has an
y la ceguera es
old
causada
age,
por
and the blindness is caused
catarata,
by
degeneración
cataract,
macular
macular degeneration, and glaucoma.
aunque no sea
And
tan frecuente,
although it is not that frequent, blindness in children is important because once the child becomes blind, he or she will take this deficiency throughout life, and be a lifelong impairment on education, work, family, the capacity to generate income, etc. And from there, we have a topic which is very important in public health, which are years of life lived with disability.
en la ceguera y
And if we
deficiencia
talk about childhood blindness and visual impairment, this number is quite important. We have much less blind children, but blind children are going to live many more years than an elderly blind due to cataracts, for example. So in this way, we give the appropriate importance to blind children. Now, Dr. Carolina has already mentioned since 2019,
y también a la parte
and
oftalmológica.
also with the ophthalmologic, with the World Report on Vision, we need to think in eye health, not only as the eye, separated from the rest of the world. We need to think in the person. So the ophthalmologic care and other types of care should be integrated and people-centered, not on pathology or diseases. And in the 73 World Health Assembly, we came with some important things for us. In red, make eye care a comprehensive part of universal health care, implements person-centered eye care in systems of health, monitor trends and evaluate progress, increase focus and engage and empower individuals and organizations and communities. In eye health, we have a very good example, and Dr. Carolina mentioned. Thinking as an ophthalmologist, and I'm an ophthalmologist, we need to think in children's eye health, not in the way that the ophthalmologist is waiting for the people to come to their office or clinic, but eye health guarantee the good visual acuity of the child, and when the child grows, that starts in pregnancy. If the pregnant woman has good health, is free of parasites, good nutrition, adequate vaccination, with correct prenatal care, this is going to significantly decrease eye problems of the child. If the child has a good nutrition with breast milk, good neonatal care, and good health in general, this is going to have a positive effect on its eyes in that moment and in the future. If the child grows with good nutrition, we'll see the same. If in the school the child has a good environment, if he's a well-trained professor to suspect ophthalmologic problems, if there's a good prevention of accidents and trauma, this child will have a higher chance of having a good vision through the entire life and a good health in general. But the access to service and quality service also depends on the family has good employment, working conditions, and salary. From the ocular diseases in childhood, we have a problem that's quite prevalent, but it's not of great concern to us in terms of low vision. These are reasons for many visits to the ophthalmologist, like many cases of conjunctivitis, chalazion, blepharitis, other types of problems that are usually would not leave any scars, and they don't decrease the vision in children. When we think in blindness and visual impairment in children, we have little data in Latin America, and that happens not because we're doing little effort, but this is a very difficult type of study to do. These are diseases with low prevalence, those who cause blindness, and for that, logistic to carry out the study is much more difficult. For this reason, most of the population studies use subjects of 50 years or more. and what we do to understand
con los
what
niños
happens with
usualmente
children is usually
utilizar estudios hechos en
using
escuelas
studies in
básicamente para
schools
errores
for
refractivos
refractive
y
errors,
también
and
estudios hechos
also
en servicios
studies
de
performed
rehabilitación
in
donde
rehabilitation
vemos
services
que
where
no
we see
mejoran con
cases that do not improve
Aquí les
with
doy un
glasses.
ejemplo.
Here
Es
you
un
can see an
estudio
example of a study
ocurrido en Ribeirão Preto,
done here
Brasil,
in Ribeirão Preto, Brazil,
donde
where I live,
muchas de las
where we
cosas que
see
está
many
en rojo
of the things in
pueden
red
ser
that
prevenidas
could be
si
prevented
con medidas que no
with
son
measures
de
that are not
oftalmología o salud
purely
ocular.
ophthalmologic or ocular
Son
health.
medidas
These are
para cuidar
measures
de la
to
mujer
take
embarazada,
care of
del
the
niño
pregnant women
prematuro,
or the premature child, etc.
Eh, también tenemos
We also have
de ceguera y deficiencia
causes
visual
of blindness and visual
que no
impairment
son problemas
that are
congénitos
not
que nacen
congenital in
neonatales,
origin or
como errores
neonatal. These are the
refractivos que
refractive
Carolina
errors that
ya ha
Carolina
mencionado.
already
Voy a hablar un
mentioned,
poco más.
and I will
También
talk a little bit more.
ambliopía y estrabismo
Amblyopia and
son
strabismus
problemas que son
and
menos
are
comunes,
problems
pero
that are less common but
con
also
mayor
very
riesgo de vida que
serious
el
with a
retinoblastóma.
risk of life, and we have
Bueno,
retinoblastoma.
estrabismo creo que
Well,
todos,
strabismus,
aunque aún los que no son
those
profesionales
who are not health
probablemente
professionals
han visto
have heard,
a
have
alguien
seen
que tuvo o que
someone
tuvo estrabismo.
who has
Uno de los
strabismus,
ojos
one of the eyes.
está acá en el ejemplo con
Here in this example, this is in the
usual y el
usual
otro
position,
está
and the other one
ah,
is
para adentro. Y lo que
looking
pasa
inwards.
es que
And what
el cerebro
happens
del
is that
niño
the brain of
está
this child
usando la agudeza visual
is
de
using the
un ojo
visual acuity of this
y
eye,
el otro
and the other one
no va a tener un
is
buen
not going to have
desarrollo
a good
de la parte neurológica.
development of the neurological
Un
portion of the
error
vision.
importante es que
A very
tenemos
important
un
problem
periodo
is that we
corto
have a short
para
period
intentar
to
mejorar
try
este
to improve
desarrollo
this
y usualmente es
development,
de
and it's
0
usually
a 7
from
años.
0 to 7 years of age.
Intentaremos más que eso
And if it takes more
y
than that,
con cirugías podemos
and
el
if
ojo
despite
en
that
una
with
posición
surgery we can
que
put
sea
the eye
mejor,
in a
el
better
visual
position, the
no
visual
va a
acuity
mejorar y
is
eso
not
se
going to
llama
improve, and this is called
ambliopía. El
amblyopia.
estrabismo es una de las causas
Strabismus
principales
is
de
one of the more
ambliopía.
important cases of amblyopia.
Fíjense que hay varios
There
artículos
are several
que
scientific papers
correlacionan
that correlate
el estrabismo, sí, la
strabismus,
persona, el niño con
a child
estrabismo
with strabismus,
y problemas de salud
and
mental,
mental health
como
problems,
depresión,
such as
etcétera. Así
depression,
que el
etc. So,
tratamiento del
the
estrabismo
treatment of
ah,
strabismus
va a mejorar no
is
solo
going to
las
improve
condiciones
not only
de las personas
the
con este
vision
tipo
of the people
de
who
problemas.
have this condition.
De los errores
In terms
refractivos
of
tenemos
refractive
la
errors, we have
miopía, el
myopia,
astigmatismo y la
astigmatism,
hiperopía.
hyperopia.
Se usan en niños sí las
In
lentes
children, we use corrective lenses with glasses.
por supuesto no se
Of
hace
course,
cirugía
we don't
refractiva
perform
ni hay
refractive
mucha
surgery
precaución.
at this
Y
age.
tenemos con niños un
With
problema que es
children, we have a
que con
problem
adultos
that's
es la adherencia
larger than with
y
adults,
es
is the
muy
adherence.
difícil en determinadas
Very
situaciones
difficult in
obtener una buena
certain conditions to
adherencia
obtain
con
a good
niños
adherence in children,
y hay que buscar
and we need
alternativas
to look
para
for
que se
alternatives
mejore.
for that
En
to
este
improve.
estudio hecho
And this
en
study
Chile
carried
por
out
el
in
arquitecto
Chile
Fernando
by
Barría,
Dr. Barria,
cuando, cuando examinara a
when
personas que
he
tenían deficiencia
examined
visual,
children with
las
visual
causas
impairment,
principales
the
eran
leading
errores
causes were
refractivos
refractive
y
errors,
después
followed by amblyopia, followed by
estrabismus,
strabismus,
procesos bilaterales o
and in
unilaterales.
bilateral unilateral cases.
Tenemos cómo hacer el
So
diagnóstico en
we
estos
have
focos
the ways to
para
do the
mejorar
diagnosis and early treatment to improve many of
casos que
these
son mucho más
causes.
difíciles
There are
de
causes that
tratar,
are more difficult
por
to
ejemplo,
treat
la
or
retinopatía
impossible,
óptica,
such as
pero
optic
la
atrophy.
buena cosa es que
But the good thing is that
tenemos la tecnología y el
if we have
conocimiento
that
para
technology and the necessary knowledge
diagnóstico y tratamiento de la
for the
mayoría de los
diagnosis and treatment of
de
most of
estos
the children at the school age. When we, in that same study, when they review the reasons of not wearing spectacles,
les contó que a ellos
most mentioned that they didn't like to use glasses.
la segunda causa
The
es
second
que
cause
los
was the
ojos
glasses
estaban
were
rotos
broken.
y esta es una
And
dificultad.
this is one
Vamos a hacer
of
una
the
campaña
difficulty
y
if we're going to
distribuir en
start a
todos lados,
campaign
todos los
distributing
niños.
glasses
Hay que tener en cuenta
to
que
all
los
children. We need to
niños
consider that
usualmente
children glasses
se rompen antes
usually break
que los anteojos de los adultos. Así que
compared to the adults. So after 6 months or a year or less than a year, we need to go back to that population and see if they are wearing their glasses. And it's usually
fornecer la prescripción y
we need to,
el anteojo con bajo costo si el costo es una barrera.
if the cost is a barrier.
Como también mencionó la doctora Carolina,
As Dr. Carolina mentioned,
una de las metas
one of the
de
goals
OMS
of
para
WHO
2030
for
es
2030
aumentar la
is to
cobertura
increase
efectiva
the
de
effective
refractivos
refractive
y
error coverage,
cobertura
and
efectiva cobertura, ¿sí? Más
this is
gente
coverage, more
utilizando
people
los anteojos
using
con
glasses
buena agudeza
and
visual.
with good
Sí, porque
visual
puede pasar
acuity,
casos que
because
la
we
gente
can have
utilizando
cases
los
where
anteojos
people are
se
wearing the
enfocan,
glasses,
no
but
cuidan con
despite that, they
agudeza
don't have
y
good
hace falta hacer
visual
una
acuity,
nueva
and we need
prescripción
to
de
issue
manera
a new
correcta. Así que el
prescription.
aumento de la cobertura
So the
efectiva
increase in effective
una de las
coverage
metas
is one of the
y
goals,
nosotros, a los
and
países andinos,
we, the Andean countries and the
latinoamericanos,
Latin American
tenemos
countries,
un compromiso
have a
en
commitment
avanzar en
in
tema.
making
Un
progress
tema
in
bien
this
importante
topic.
en
A very
refractivos,
important
creo que
in
muchos de ustedes
topic in
ya han
refractive errors,
escuchado eso,
as
es
you've
la
heard before,
pandemia
is
de la
the
miopía.
epidemic of myopia.
O sea, tenemos año a año
We
más
have
casos
year after year
de
more
niños
cases
y
of people,
adolescentes
children,
con
adolescents
miopía.
with myopia.
Esto pasa más frecuentemente
This is more
en
frequent and
países
seen
como
in
China y
Asian countries
Corea
such as
y
China,
Japón,
Korea,
pero
Japan,
pasa también
but it
en México.
also occurs
Y hay muchas
in
teorías, muchas
this
explicaciones
part of the world. There are many
y por
explanations or
eso
theories.
nosotros estamos cada vez más
We are
haciendo actividades
doing more nearby activities
móvil,
with a mobile phone,
pantallas,
with a screen,
con más horas
with
en
more
escuela
hours
que antes
in school
y
than before,
relacionados a poca
and also
exposición
related to a few
solar.
exposure to
Y aquí
sunlight.
está un ejemplo
And here we
de
see an
países
example
del
of
Oriente
countries
donde está
from
aumentando
Asia
muchísimo
where there's
la
been an
prevalencia
increase in
de
the
miopía.
prevalence
Y
of
esto
myopia,
es un problema
and this is a
acá en la región, principalmente
problem
porque
in
no
this
tenemos
region
una
because
cobertura
we don't have
adecuada
adequate
y si se
coverage,
aumentan los casos,
and there's an
aumenta la necesidad
increase of the
de
cases
comprar
and the needs for evaluation
prescripción
and
de
prescriptions
anteojos de bajo costo,
of
etcétera.
buying
También para
low-cost
personas que
glasses, but
tienen
also for
altos
people
grados de
who have
miopía, ya
high-grade
ellos pueden
myopia.
empezar a tener
They can
otras
start
complicaciones
having
como
other
desprendimiento
complications
del
such
brillo y
as retinal
alteraciones maculares
detachment
que no
and
serán
macular
por supuesto
alterations that
corregidas
are
por
not corrected
lentes
with
ópticas. Así que
glasses.
este es
So
un gran reto.
this is
Hoy
a
en día
major
para
challenge
nosotros mucho más
nowadays,
por la
much more
cobertura
because of
eficiente
deficient
de los
coverage
servicios
of
refractivos en la región.
refractive services in the region.
Hablando de otros temas,
Speaking about
hay
other
un
topics,
grupo de
there
problemas
are a
congénitos y
group of
neonatales
congenital and
donde
neonatal problems
la
where the
educación
intervention,
antes que el niño
education
nazca
before the
antes
child is
de que
born
venga
and
al
before
oftalmólogo es
it visits the
vital.
ophthalmologist is
No solamente
extremely important.
es
It's not only
básico,
important, it's
sino
extremely
es
important.
imprescindible. ¿Sí? Acá
It's
como ejemplo
instrumental.
les doy
For
la campaña
example,
del
this is
prematuro.
the
No es un problema de
ROP.
los ojos, sino que
It's
hemos
not an
escuchado
eye problem, but it's a problem
de la
of
neonatología
the
y es un problema de salud
neonatology
pública en
and a
nuestra
public health
región
problem in our
y
region,
también las infecciones
and also
congénitas
the
eh,
congenital
que
infections,
les daré
where
algunos
I
ejemplos.
will give you some
Un test
examples.
muy
A
importante
very important
en
test
algunas localidades donde hay
some areas where there is a law.
en el estado de São Paulo, en
In
Brasil,
the
hay
Sao Paulo state, there's a law that indicates that children, when they are discharged from the maternity hospital, they need to go out with a checklist, and part of that checklist is the red reflex test,
y donde el pediatra, no el
where the
oftalmólogo
pediatrician, not the ophthalmologist, performs the test. And is there any doubt or if there's any impairment in the following 15 days, the child needs to be seen by an ophthalmologist to confirm or rule out the condition and to offer the treatment if necessary. These are some examples of the normal red test. We don't see the red here. There's a problem here too. Here, this is a case of cataract. This is another problem. And this is a very simple screening. And from here, the ophthalmologist will perform more detailed tests to find out what's going on, if this is a problem, so treatment can be as quick as possible. Two problems of delay for treatment. One, if this is a cataract, the vision is not going to be under a good development, so we need to remove the cataract as soon as possible. And although less frequent, this may be a tumor, a retinoblastoma that I will talk later. So the treatment is also important for vision and to decrease the life risk. As I mentioned, this is an exam not made not by the ophthalmologist. The ophthalmologist is going to make more detailed tests, but a good example of suspicious and referral of patients of people who are not experts in eye care, but have been trained, and this is very important.
Profesionales de salud ocular,
The ocular health professionals, the ophthalmologists, optometrists, we only see those who have problems, and they usually come late. So it's very important to have this screening by health professionals, but are not ophthalmologists. The retinopathy of prematurity is a problem that is included in the medicine textbooks in the 40s and 50s, because this didn't exist, because before that all the prematures didn't survive. And when they start surviving, the physicians in the US detected that they had an eye problem, and soon they found out that the problem was to be born premature, survive, and don't have an adequate monitor of the oxygen level. When this improved, they also improved the incidence of ROP, but when other countries, other areas
empezaran a tener niños
start
sobrevivientes,
having survival,
de
this
retinopatía
is the second wave of ROP, and we in Latin America, since the 90s, we are in the third epidemic, and now we are the region with the highest impact of ROP. So to have a child with premature retinopathy of prematurity, you have to be born premature, survive, and don't have the proper care. And this is what unfortunately occurs in many parts of the region. As an example, I spoke with a colleague from Haiti, and she told me that they don't have prematures. There's no retinopathy of prematurity because unfortunately they don't survive. So when the health services improve, the epidemic is going to reach countries with a lower level of development than most of Latin American countries. There's an estimate that in 2030 that is going to occur in countries that are now poor in sub-Saharan Africa. As I mentioned, the expansion of services with inadequate quality. And this is what, if a child is born prematurely, part of the retina has no blood vessels, and this region stimulates the production of vessels, and this may create several problems and cause the detachment of the retina. And the treatment is to use laser in this region, so the neo vessel stimulus is blocked. We call premature those less than 36 weeks of gestation, and ROP is more common in children born with less than 32 weeks and less than 1,500 grams. These are some images of abnormal vessels with increase of tortuosity, and here we see laser scars in the peripheral retina. And congenital infections, although it's difficult to have data from several countries, but what we see in Brazil, Colombia,
principalmente la toxoplasmosis.
Toxoplasmosis is one of the leading causes, sometimes as important as ROP in some areas. Here where I live, this is a very important problem, and because the retinal cells don't divide, don't regenerate, and the goal is to prevent infection of the pregnant women, because if that occurs,
la persona utilice las drogas
if
correctamente,
the person uses the adequate drugs and the person is healthy, in addition to the eye problem, this person is going to have a visual impairment throughout their life, because this part of the retina is not working. It's much more important than the ophthalmologist's effort is the obstetrician, family doctor, the nurse that is there evaluating and following the pregnant person, because a problem there will generate problems throughout the life of the child. The retinoblastoma is a major concern, although it's not that frequent.
neoplasia.
This is a cancer, and the person
El ojo
may lose the eye and
de
has the risk of death.
de neoplasia
It's a type of cancer that's highly curable if diagnosed quickly and treated appropriately. And this that is the issue in our region.
tenemos que avanzar
So we need to work in education, so any suspect can come as early as possible, so these children receive the adequate treatment.
El tratamiento puede ser local
Treatment may be local or systemic, with chemotherapy,
con radioterapia.
radiotherapy,
El tratamiento
and
avanza de una manera
treatment
que nos permite
is
mantener
applied in a way that we can preserve the eye structure, but it still depends on the high degree of suspicion and early diagnosis. So the red eye reflex is extremely important. This is an example of a child with this impaired red reflex in the right eye, and this is not necessarily a retinoblastoma, but with this difference, this child needs to be evaluated quickly, and
un retinoblastoma
if it's a retinoblastoma, it needs to be treated as soon as possible.
Desafortunadamente,
Unfortunately, this is not the case that we can restore vision,
que
but
pensar
we don't have to think that everything is lost, there's nothing more to do. And for that, we need to work
la capacitación y el
in
número de los servicios de
training and the number of rehabilitation services
en la gran
that
mayoría
are also lacking in most of Latin America.
Y este es muy importante para
And
los
this
que
is
no
very
tienen
important for those who do not have the opportunity to restore their vision.
acordarse también
We also need to remember that
personas con deficiencia visual,
people with visual impairment,
igual que los que tienen
in
otro
a similar way
tipo de
of people who
deficiencia,
have other type of impairment, need a psychological support
para depresión, etcétera.
for depression and other conditions.
Tienes que ser parte
And
de
this has
los
to be
servicios de
part of
rehabilitación.
the rehabilitation services. And we also need to consider that
De los niños, de las personas en general,
some of the children and persons in general who have visual impairment also have several impairment or multiple impairments such as hearing impairment. We need to think in the person and not the disease.
Dentro de varios retos que tenemos
Among the several challenges in our region, one of them is the number of eye health
el doctor
professionals. Dr. Juan Carlos Silva, who worked as an advisor until last year, he did a very important study where in this red square,
de una manera simplificada,
in a simplified manner,
nos muestra que
this show that these countries
cantidad
have
más pequeña
a smaller amount
de profesionales y
of professionals that we need,
están
and the professionals
zonas
are
más
concentrated in the more developed areas.
los
Usually,
ciegos y
the
deficientes
blind
están en
children
zonas
are not
desarrolladas,
in developed areas of
en
the
las
country,
afueras de la
are
ciudad.
usually in
Que no es
the
solamente el número,
countryside. So it's not just the number,
la distribución,
but also the
es un problema
distribution.
difícil
And this is a
de mejorar.
problem very difficult
Una
to
discusión
improve,
amplia, pero los países tienen
but
de
countries
distintas maneras
will
tienen
have
que
in different ways
retener y atraer personas
attract
en la selva, en las
people
zonas
in the jungle, in the rural areas,
de los ríos,
close to the rivers
porque
and the outskirts, because there we have many people that need
trasladar
this care and cannot come to the city or pay
los servicios.
for the services.
Bueno, ya terminando mi
Well,
presentación,
finishing my
que
presentation,
persona tenga
for a
una
person to
buena
have
salud a lo
a
largo de su vida,
lifelong
nosotros
health,
dependemos de muchas
we
cosas,
depend on many
pero
things,
también de la
but
salud visual.
also of visual
Los
health.
niños con buena salud
Children
visual
with good
tienen
visual
mejor
health have
desempeño escolar,
better school performance.
un mejor
Those who
desempeño
have a
escolar,
better
progreso
school
más rápido,
performance
tienen más posibilidades
have
de buenos
more
empleos,
employment opportunities,
tienen mejor acceso a la
have
salud.
better access to health, and when
La
they
final de sus
are
vidas,
at the end of their lives,
menor
they
dependencia
have
de
a less
cuidadores.
dependence or on caregivers.
Como conclusiones,
As conclusion,
los errores refractivos que
refractive errors
son la causa principal de
that are the
deficiencia
main
visual
cause
en
of visual
general,
impairment,
no solamente la
we need to
cobertura, sino que
improve
la calidad.
coverage, but
Y para los
quality,
niños
and for
específicamente
children
buscar
specifically, we need to look for alternatives
vemos que la
if
adherencia
we see that the adherence
buena,
to glasses is not
hay que
adequate.
pensar
We
fuera,
need
sí, hay que
to
pensar
think outside the
una
eye
persona
in a
sí, con
person
salud
as,
y
with
con la
their health
integrada
and with the comprehensive
otras áreas, no
health,
solamente en
not
los ojos.
only
Y que
eyes,
no hay cobertura
and that there's
universal
no
si no
universal
buscamos un
coverage
sistema
if we don't make any
integrado
progress in
con
the
los
eye
ojos.
care.
Y otra vez más,
And once again,
los oftalmólogos
the
suelen estar en
ophthalmologists
clínicas
are
con aire
usually in
acondicionado,
their
así que
clinics
es
with
muy
air condition.
importante que
So it's very
personas que no
important
tienen
that people
información
that
de
don't
salud
have
tienen
training in health or who have training but are not experts, they suspect, have a high degree of suspicious, and to send
niños con
children with who you suspect eye problems and should be sent to the ophthalmologist, mothers, fathers, teachers, pediatricians, nurses, and family physicians. Without a good communication, good training,
problemas llegan tarde.
the problems arrive late and we cannot help. So education is key
El buen funcionamiento
for
de
the
todo.
things to work. As conclusion,
Salud
for a good eye health and the person in general, a combination of education, prevention, promotion, early diagnosis, treatment, rehabilitation, and also without forgetting management of related health problems. Let's think in people and not only the health problems that they have.
Muchas gracias.
Thank you very much. Once again, it's been an honor to be here, and I'm at your disposal for any doubt.
Agradecemos la
We
intervención
thank the intervention of Dr. Joao Marcelo Furtado, who has spoken.
Usualmente pensamos en
We
ceguera
usually think in blindness or visual impairment in the elderly, and although it is less frequent, children's blindness, this is going to be carried out through the entire life, so it's going to have an impact in education, work, and family.
Asimismo, pues los años de vida
Also, the years of life with disability are extremely high in this individual, and we need an early intervention to treat this problem. There are measures that are not in the ophthalmological field, but if we apply them since pregnancy and birth, we could prevent many low vision and blindness disorders. He has spoken about strabismus, where there's a short window for correction and preserve visual acuity, and also refractive errors such as myopia and astigmatisms, hyperopia, the adherence of children so they can use their glasses. You mentioned that important study in Chile where people with visual deficit seen the importance of refractive errors followed by amblyopia and strabismus. It's important to highlight the use of glasses in children. We need to follow them with not only to provide them in 6 years later or before the year, these children can lose it, break it. So it's important to provide follow-up. You spoke in the so-called myopia epidemic with the increase in this problem more accentuated in Asian countries, but it's also present in our countries. And this many times is influenced by the activities that are no use of mobile phones, the use of screens, longer stay in school. So this is a serious problem in our region. There's an increase in the need to be evaluated and treatment and also consider the costs in the system. You spoke about ROP as an important cause of blindness and how our region has a large impact in ROP. And unfortunately, this is present because there's an inadequate management of the premature child. You spoke about retinoblastoma as of concern. It's more infrequent. It requires an early treatment and early diagnosis and adequate treatment. Insisted on the challenges of the number of ophthalmologists you mentioned. Is not uniform in the countries.
Tenemos muchas zonas alejadas de
many remote areas,
las comunidades altoandinas, pues que
the
definitivamente
highland, or they don't have an ophthalmologist around.
es importante que las personas que no tienen una
So
formación
people who don't have adequate training in health or are not necessarily ophthalmologists can suspect and send those patients or those children to the ophthalmologist that require more evaluation and early treatment.
Y esto pues involucra a padres,
This
profesores,
involves parents, teachers, pediatricians, nurses, and other physicians, such as the family practitioners. Dear Dr. Marcelo Furtado, we reiterate our thanks for the lecture and we invite you to remain in the room. At the end, after the presentation of Dr. Mueller, we're going to conduct a dialogue in response to the questions from the participants. Thank you. Now, to present the policies and interventions with the greatest impact on childhood with life course approach in the prevention of visual loss and blindness, we warmly welcome Dr. Andreas Mueller,
quien es director
who is the Deputy Director of the World Health Organization Collaborating Center for the Prevention of Blindness of the World Health Organization and consultant to the World Health Organization. He has experience in vision science research and epidemiology and has worked in various sectors of the public health field, in the academia, in the non-government sector, and in the United Nations system. From 2011 to 2016, he led the WHO Prevention of Blindness program at the regional office for the Western Pacific region, where he was responsible for the development of the first WHO Regional Action Plan for the prevention of blindness. His research interests include innovative strategies to improve quality and efficiency in the delivery of eye care services in low and middle income countries, including the use of technology for population-based screening of eye and vision diseases. Welcome, dear Dr. Andreas Mueller. You have the floor. Go ahead.
Thank you very much for the introduction, and thank you for giving me the opportunity to speak at this very important webinar today. My colleagues did a fantastic job already in setting the scene. My colleague, Dr. Carolina, spoke about some of the key developments of the eye care sector globally. And my colleague, Dr. Zhao, touched more on the pathology of eye disease globally, but specifically in your region. So what I will be talking about today is some of the WHO tools, some of the WHO guidelines and frameworks that hopefully help countries in implementing some interventions to strengthen eye care in a way that is integrated and people-centered, because as you've heard already, this is the strategic recommendation from the World Health Organization. There are some key challenges, and most of them were mentioned in the previous recommendations. Presentations. We know that even though we have very effective interventions in the eye care sector, such as cataract surgery or spectacle correction, yet globally we have a high level of inequity when it comes to accessing eye care services. These inequities appear to be much higher in low and middle income countries, and they appear to, as we heard, be much higher in vulnerable populations, which also include children. The reality is that many countries globally do not include eye care services within national health insurance schemes. The reality is that cost is still a major barrier to accessing eye care services around the world. And there are several factors that accentuate these challenges. One of them are major demographic trends. We know that age is the key risk factor for vision impairment and blindness, and yet we have aging populations around the world. We also know that myopia, for instance, is an epidemic that is somehow linked to lifestyle changes, also starting in early age. So growing populations and these changes in behavior are also contributing to the challenges. And from a planning and implementation of eye care point of view, the reality is that in many countries, eye care is not well integrated within health systems. Eye care is too often still a vertical program that is considered to rely on highly trained specialists and to rely on expensive and very specialized equipment, and funding for eye care too often only ends up in tertiary specialized eye care hospitals, whereas at the same time, we know most eye conditions can actually successfully be addressed at the primary level or even community level of care. Yet this is where eye care is often not very well integrated within healthcare when it comes to screening, when it comes to raising awareness, when it comes to making referrals and so on. At the same time, we know human resources for eye care are often not very well coordinated within wider health systems. So there are two WHO tools that were recently launched that I would like to discuss in my presentation with you. The first one, and this was already mentioned in my colleague's presentation earlier on, the first one is the package of eye care interventions launched earlier this year. And the second one is a toolkit to help countries develop and implement myopia prevention campaigns. These tools were developed for Ministry of Health and other ministries that are involved in the delivery of eye care. They are also developed to be used by service providers in a wider sense, and of course by any agencies, development agencies that are responsible for providing eye care services in countries. Let's start with the package of eye care interventions. What is it? The package of eye care interventions was developed to help countries in prioritizing eye conditions and treatments for those eye conditions, and help countries with the planning to make these treatments and screenings available at each level of the health system. So it is a package that lists a number of interventions and treatments and rehabilitations considered a priority based on how feasible the treatment outcome of these eye conditions would be in low and middle income countries in particular. So it's a tool to help for the planning of eye care services integrated within health systems at each level of the health system, primary, secondary, and tertiary. This tool also was developed to better integrate eye care within WHO's Universal Health Coverage Compendium of Interventions, which is a extensive list of WHO recommended interventions for health at each level of the health systems towards universal health coverage. And so to make sure eye care is part of that list and is increasingly integrated within health systems, this package has also been developed. So what is in that package? I mentioned to you that the package contains lists of interventions and how to apply them. So it actually contains evidence-based interventions for health promotion and preventions, interventions for screening, interventions for treatment, and interventions of rehabilitation. So these are evidence-based interventions considered feasible to be applied in low and middle income countries across the continuum of life. So and across the health system broadly. And most of these interventions are applicable not only to adults, but also to children. So here is an example of an intervention such as the spectacle correction for refractive error in children. So the package of eye care interventions would then go in more detail at what stage of the life course this intervention is applied, at what level of the health system this intervention is applied, what other health or non-health programs or sectors should be involved in the delivery of this intervention, i.e. spectacles, and what equipment, medicines, and what consumables are required by the health system to provide this intervention. So it will discuss the optical equipment and that is required for the optical services across the health system. So in addition to that, it also includes information about how long it takes to provide the service, what is the requirement of the workforce to provide these services, and it also gives estimates for the cost to providing these services. So overall, it is designed to be a comprehensive tool to help for the planning of integrated eye care within wider healthcare. So let's look at some of the examples of interventions that are listed in the package. So when it comes to health promotion and prevention, the package lists a number of and describes a number of promotion priorities aiming at children and their parents, but also at health workers. So here you see some of the examples discussed in the package, such as nutrition and immunization to prevent secondary conditions, or the importance of having regular comprehensive eye examinations, which would be aimed at children and their parents, or the need for oxygen management to prevent ROP, which we've just heard about, or prophylactic management to prevent ophthalmia neonatorum, which are messages aimed at healthcare workers. In regards to the screening, the package, when it comes to children, the package describes various parts of childhood and the screening recommendations. So obviously, every country in the world has their own policies, their own national guidelines. So these are evidence-based recommendations by WHO that were developed by reviewing major global guidelines and research in regards to conditions. So here are the recommendations. To give you an example, during the neonatal period by WHO is to have an external eye examination and a red reflex test that we also just heard about for all newborn children to detect pediatric eye conditions. The package also describes the recommendation to screen all preterm infants and or low birth weight infants for ROP. In the early childhood and later childhood term, the recommendation is for vision screening and eye examination in 2 stages, at preschool as well as school age, depending on the epidemiology. What does that mean? That means that a country will need to assess their own prevalence of uncorrected refractive errors, which is the key eye condition that is being screened for at the school age. Each country will need to assess their own epidemiology for uncorrected refractive error and then make an evidence-based decision on whether this recommendation for screening at preschool and school age is based on evidence. So there will be countries where this is not justified based on the epidemiology in the country. And there are other countries, and of course I'm thinking of many countries in the Asia region where uncorrected refractive error is very high, as we also just heard, and where these screening recommendations are more likely to be evidence-based and should be carried out. And then, of course, also, as we just heard, the need to screen people with diabetes for any sign of diabetic retinopathy. And this can be of course also impact on children, and hence is a relevant recommendation. When it comes to the treatment, the package will have a long list of interventions that are recommended based on evidence of being affected. So here is a list of some of the examples, and as I mentioned, the package will then also list required equipment and including some cost affiliated to provide these kind of treatments for those priority eye conditions that are common. When we look at rehabilitation, the package then lists some interventions such as the need of referral. The need describes the provision of optical and non-optical assistive products and how they should be provided, by whom they should be provided, and so on. Overall, and that has also been mentioned before, the issue of vision rehabilitation and low vision services is often neglected in most countries in the world. And where such services are available, too often there is a lack of awareness about the availability across the population, as well as clinicians, and referral systems overall are often not adequate. So this was my last slide for the package of eye care interventions. And I now would like to move to the second tool that I mentioned to you, recently launched by WHO, the toolkit on how to implement myopia ed. So myopia ed is a term for WHO's recommended a health promotion program at country level to prevent the development of myopia. And it is basically containing of a suite of evidence-based messages. It provides guidance and the resources needed to implement and monitor a prevention program for myopia, and is designed to assist policy and decision makers or any group implementing eye care to establish a large-scale national program. We already heard in the previous presentations about myopia and the often used term of an epidemic, but the numbers are clearly staggering. We know that in 2020, globally, we estimate 2.6 billion people have myopia. The prediction is that by 2030, this number will go up to 3.4 almost billion cases of people with myopia. So clearly the need globally is staggering. Hence, this tool was developed to aim at different target populations, such as any population involved in the care of children, parents or caregivers of children with myopia, or adolescents and adults with myopia. The key themes of the messages are to help people understand the causes and warning signs and some of the misconceptions around myopia, to introduce, to promote behavioral changes that can reduce the risk of high myopia and its complications, the importance of regular comprehensive eye examinations, and also the importance of compliance with spectacle correction. And we know in terms, some of the key messages in terms of behavioral change, as it was mentioned, refer to the need to reduce extensive near work, whether it's screens or reading, and to promote for children to spend more time outdoors, as these are two evidence-based factors that influence the development or the onset of myopia. This program is designed to work via smartphone messages, one-way SMS messages to the target populations that I just mentioned. But the technology can also be modified to fit any platform that is most appropriate in that country or other social media areas. It is designed usually to run over 12 months period, or 6 months, for 12 months for the general population, or 6 months for other users with myopia. And as I said, the key message format is to motivate people to provide support and to provide information or reminders for people in regards to behavior change. Here are some example messages. For instance, did you know that if a parent has myopia, their children are more likely to develop it too? Or to encourage your child to go outside and play, informing about help and support available, or as a reminder message to wear glasses every day at school, etc. So in summary, for the summary information across these tools is that what we have is available guidance on recommended evidence-based eye care interventions along the continuum of care. And we also have guidance on the delivery platforms and the materials, the resources and requirements that are needed to implement the interventions in countries. WHO recently developed some other resources that perhaps you will find helpful. We've developed a suite of health information material, awareness-raising material that you may request. I've got my email at the end of the presentation if you would like more information or if you would like materials shared. So some of these materials are relevant to children, such as the need to have regular breaks during near work, or the 20-20-20 rule, promoting that every person after 20 minutes spending on a screen to look at an object at least 20 feet away for at least 20 seconds. WHO is also about to launch a smartphone app, an application to allow any person to test their vision, to test their visual acuity at near as well as at distance without the need of an eye care specialist. The application will also carry some health promotion messages, some of which we've just mentioned, for people to increase awareness for populations around the need for regular comprehensive eye examinations and how to protect their eyes better. So we plan to launch this tool early next year. And if you go to the website listed here at the top, you will find the tools I've mentioned, most of them also available in Spanish, plus various additional tools WHO recently launched for the planning and for the implementation of eye care services in general, but also condition specific, such as tools to assess the national situation or subnational situation for eye conditions such as glaucoma or refractive error or diabetic retinopathy. With this, I would say thank you for attention, and I'll pass back to the moderator. Thank you.
Agradecemos
We
la
thank the intervention of Dr. Andreas Müller, who today has lectured us on the important challenges we face in addressing the problem of eye health, the major gap that exists in low and middle income countries and in vulnerable populations, which is exacerbated by the lack of integration of health systems. To this end, Dr. Müller introduced us a whole package of ophthalmologic interventions, tools proposed by WHO to help countries make decisions on which interventions to prioritize, how to budget for them, and their subsequent integration into health services, packages, and policies. It has been very interesting and instructive to learn about the package of interventions in eye health, which involves various interventions from clinical assessment, health promotion and prevention, diagnosis, treatment, and rehabilitation. It has also highlighted the interventions to be performed in childhood from the neonatal period up to and including early and middle childhood. Finally, we have been able to learn about the digital messaging myopia aid. With this messages program aimed at education about myopia and its prevention. It is an evidence-based messaging guide for key populations that provides guidance and operational resources to adapt, implement, and monitor the myopia aid program, and would assist policymakers and implementers in establishing a national or large-scale program, which aims to support a behavior change to help delay the onset and slow the progression of myopia and improve health awareness and knowledge of the importance of regular eye examinations and spectacle compliance among children and adults with myopia, with motivational, supportive, informative, and reminder messages. Dr. Andreas Müller, we thank you again for your presentation and invite you to remain in the room. We will start the Q&A session shortly. Before we continue with the Q&A, the last portion of this important event, we would like to greet all who are connected and follow us from countries from Argentina, Bolivia, Brazil, Chile, Colombia, Ecuador, Cuba, Guatemala, Mexico, Paraguay, Peru, Switzerland, and Venezuela, and with several other institutions that have joined us, such as Lima Center, DIDIS, the Cajamarca National University, Peruvian Red Cross,
la Universidad Nacional de
the Cajamarca National University, the Navy Hospital in Peru, the Peruvian Air Force, Social Security of Loreto, Peru, the El Trébol Health Facility in San Juan de Miraflores, Chulucanas Hospital in Morropón, Piura, the Mother and Child Center of Jean Paul II in Villa El Salvador, and Apurimac. After these moments of learning and exchange of knowledge, it is essential to go to the Q&A and the questions sent by the audience. We invite our three speakers to start their videos. During this webinar, we have received some questions and we will try to respond most of them. Question for Dr. Carolina Holmes. What percentage of GDP of the countries is recommended to allocate for the design and implementation of visual health policies? Hello, Magda. Well, this is an extremely important question. Unfortunately, I don't have any way to respond to it. I couldn't tell you exactly what is the percentage to be allocated. That will depend on each country.
No sé si alguno de mis
I don't
colegas.
know if one of my colleagues perhaps has that information, but
No podría darte una
I
respuesta.
couldn't give you an answer right now. I don't think that there's a specific number, and because there are different realities, it's very difficult to set up a number.
Hay otras maneras
There
de
are other ways of evaluating the quality and coverage of services. That would be more relevant than stating a specific number.
And if I can
Excellent.
perhaps,
Thank you.
Andrea,
if I can just add perhaps of one of the points I made earlier, I think it's, I agree. I don't think there is a particular target number, a dollar figure that is recommended, but the reality of the primary level of care not receiving enough funding for eye care, I think that is really an issue that is feasible to address and to where to make changes to try and channel funding from tertiary level hospitals where people go often for conditions that can be addressed at the primary level or maybe the secondary level of care, but this is where the services are not available, where there is a lack of awareness, and where other non-ophthalmologists or non-optometrists could potentially provide so much of eye care already, and in a very cost-effective way. So it's in most countries in the world, really what we need to see is a shift of resources and expertise and training from the tertiary to the lower level. Back to you.
Muchas gracias a nuestros tres ponentes por la respuesta. Pregunta para el doctor Joao Hurtado. ¿Cuáles serían las evaluaciones básicas en el
What will
hogar
be the basic evaluations at home if you suspect
en los infantes?
visual conditions in infants?
Pues mira,
Well,
en el ejemplo que les
in
mencioné,
the example that I mentioned about the retinoblastoma, something that usually happens is that half of the suspicious cases, this comes from mothers and fathers when they take pictures of their child and see that there's some type of problem. But
por ejemplo,
we can find out if the child in general has good visual acuity. It could happen in one eye but not the other. But if the child doesn't have visual acuity or is some suspicious of strabismus, if you take a picture you see a difference in color, and if it comes back to a house from school and they indicate that they cannot see the blackboard,
sugerencias que
this
puede
may
pasar
suggest that there may be something wrong and that they have to talk with the pediatrician, the ophthalmologist, or the family practitioner, depending on the situation.
Muchas gracias, doctor Furtado, por la
Thank you,
respuesta.
Dr. Furtado, for your answer. A question for Dr. Andreas Müller. What will be the most important indicator of outcomes of the two WHO policies that you have presented?
So we don't have
No,
defined
no hemos
outcome
definido
indicators for individual tools. But what we recently, what WHO member states recently, as in last year, at the World Health Assembly have agreed on are the two global targets that were mentioned by my colleague, Dr. Carolina, which is one is the effective coverage of cataract surgical coverage, and the effective coverage of uncorrected refractive errors. So not only providing surgery for cataract or a pair of spectacles, but also providing a good outcome of that service. So all these tools that I mentioned that are available from WHO are all designed to help countries implementing some of those recommendations from WHO about integrated people-centered eye care to achieve these tools, how to reach the populations, how to train the workforce in eye care in a more competency-based and integrated way, and so on. So basically, we do not have tool-specific indicators, but we do now have, and this is fantastic, to have global indicators that countries will be requested to report on what progress has been achieved with these two global targets.
Muchas gracias, doctor Müller. Pregunta
Thank
para
you, Dr. Müller. Questions for Dr. Holmes. Do you have evidence on outcomes in terms of quality of clinical practices and the impact in the quality of life of the population of the screening policies of ROP in Argentina and Chile? What will be the next steps in this country that show progress, significant progress in South America?
Bueno, sí, yo creo que todo el
Well,
esfuerzo que
I
se
think that all the effort done in developing this initiative with ROP, the important is that these guidelines and tools are made for care of the neonatologists and pediatricians so they can
implementar estas guías
implement these guidelines, and somehow by this they will reduce this situation of ROP. So what we saw
artículos que
in
compartí con
the articles that I share with you, that yes, it's been very difficult to reduce the cases of ROP, especially this article that I show you where 11 countries participated. So this type of initiative magnify the impact that benefits the population at large, in this case, the newborns, and I will say that it is so that those who work in visual health may do an important contribution is to offer pediatricians and those who work with adolescents with this type of tools that's been developed by WHO to help in reducing this prevalence of diseases and provide a better quality of life throughout the life course of these individuals and populations.
Muchas gracias,
Thank you, Carolina. Now, a question for Dr. Joao Furtado. What training opportunities in visual health evaluations are available for non-ophthalmological clinical professionals?
Me gustaría
I would like to add to what Dr. Carolina mentioned is that although we have countries where in average, they do more and better in ROP. And the same happened with other cases. We need to consider that the access is quite different where we compare a city with another one or different socioeconomic levels in the same city. We need to consider that these countries are at a good level, but if we find out, then we're going to find people that who don't have access, and if they have access, the quality is not that good. This is what we usually see. Well, with regards to your question, this is very different to a country or another, but I'm going to tell you what can be done. And there's also different ways of different types of professional optometrists. But in my opinion, for other isolated areas where the ophthalmologist doesn't get there and never is going to get there, training with telemedicine, with cameras to take pictures, we can train in fundoscopic photographs of the anterior chamber with a support and distance training, so that we can treat the easy cases of refractive errors or send the most difficult cases or surgical cases be referred. This changes from country to country, but I think we can make progress in this area in situations where there is a lack of ophthalmology specialists and there's no perspective of improving this number.
Gracias.
Thank you for your answer, Dr. Furtado. Finally, a question for Dr. Mueller. What technical support or recommendations would you suggest to give the ministries of health that are considering to add these policies in their regulations?
Yeah, it's really, this is a good time to discuss how to integrate eye care within wider health planning and policy making, because we've just had some very high level developments that were mentioned. We've got World Health Assembly resolutions where all member states, including the countries in South America, have agreed to strengthen eye care, have agreed to develop integrated people-centered eye care, and have agreed towards these global targets. So now is a good time to advocate to your government on ways forward and propose how to achieve these targets and how to achieve these agreements. So if you go to the website that I show you, if you look at World Health Assembly, World Health Organization and blindness or eye care, you will also find a document called the Guide for Action. That is a document recently launched by WHO, which talks exactly about this, about advocating to government, but also how to plan eye care and implement eye care in a country towards integrated people-centered care. And it's all the emphasis on integration and where are the opportunities to integrate eye care better, and what technical support, what other tools are available from WHO to make it happen. So really, the best would be to have a look at this document called the Guide for Action, or Eye Care in Health Systems Guide for Action, at the WHO website. And please do feel free to contact us, any of us, directly by email if you would like some specific recommendations, or if you would like WHO in the discussion on how to strengthen eye care, or the discussion with your government in your country. I really encourage you to reach out to any of us directly, or ideally my regional colleagues, or your country office in the country you're from.
Bien, muchas gracias, doctor Müller. Muchas gracias a los ponentes.
Thank you, Dr. Mueller. Thank you for your speakers, for your answers. We also thank the questions that were sent. There is no time to respond all of it, but we will take into consideration to define the topics of the following webinars. We value your participation and your interest. To close this important event, Doctora Carmen Calle has the floor to close this webinar on behalf of the Andean Health Organization y Policy Non-Agreement. Go ahead, Dr. Calle. I would like to thank a final message from each one of the speakers. What would you recommend? What is the most important that has been said? Could you please? We will start with Carolina.
Bueno, yo
Well,
diría
I will say that it is very important to take into consideration these critical and sensitive periods, not only in the person, the first stages of development, but also when should we act, especially to have better outcomes in visual health and not affect this health trajectory of this child even before it's born. So this is extremely important if we want to have a quality of life and health trajectory that's good and that this child develops its maximal potential and has no problems ahead. That would be my final message.
Gracias, doctora Carolina.
Thank you, Dr. Carolina. Go ahead, Dr. Furtado. What I would like to add to conclude is that we have the idea of the importance of eyes and eye health, but when we talk with the governments and the societies, we are fighting for budget and for actions in other areas. So if we put the problem not as eye health, but also children's health, we will be stronger and we will have more chance of being successful, and we will reach our final goal, which is a good health for everyone throughout your life.
Excelente, doctor Furtado.
Excellent, Dr. Furtado. Thank you very much. Go ahead, Dr. Mueller.
For me, in terms of delivering eye care during childhood, depends all on early detection. It's important to detect eye disease early before it impacts either the learning or cannot be reversed. So screening for vision and screening for eye conditions is extremely important during childhood years. And there will never be enough optometrists and ophthalmologists across South America to do all this work by themselves. So we rely on integrating these screenings within other health screening, within school health initiatives. We need to, as professionals, we need to make sure that the eye care screening and vision screening is integrated with other initiatives by the education sector, not only relying on health professionals. So integrating screening, integrating vision tests and eye tests for children, and talking to others. Even if, as eye care professionals, if we have a planning meeting, make sure someone from the nurses sector attends, someone from the education sector attends, not only talk amongst our own peers and professional networks. That would be my recommendation.
Muchas gracias.
Thank you. We thank you for your excellent presentation. To all the attendees who follow us, which to the Horas Conju team and all who have participated in this activity, which has been possible thanks to the commitment to the Andean and Latin America integration. Now I give the floor to Dr. Calle for closing words. Well, my first words to thank you. Thank you, Carolina. Thank you, Joao. Thank you, Andreas. It's been, the message is clear. Visual health is part of comprehensive health, and if we don't include it in screening, then what are we talking about? It is clear that we looking for the red reflex when they are very small, where we give special care to premature babies because we know that prematures are going to have other types of problems. Since we add the visual acuity evaluation in the first years, and this is not a work of only the health sector. This has to be an effort among sectors, and I think that the Ministry of Education, what the schools, the Ministry of Education is extremely important in this area. I think that the most important has been said, that we're not good and that we haven't complied with what we had to comply, and there are great demands. Carolina, you mentioned of increasing coverage in an amazing number, but you also show tools that should be close to everyone. And this is what the Andean Health Organization is going to do. These tools need to be, we have Spanish version, so we will have to share it with our 6 member countries to make it in a more efficient way. It is also important to mention what Joao mentioned that I think is extremely important. Let's start with children. The issue is children's health, and in children's health, it would be easier if we include visual health as children's health, because as Andreas mentioned, let's make early diagnosis. We don't say this child has myopia, where this child has difficulties in learning in school. I think it's been an excellent webinar. We've had a lot of participation. We're talking about the 400 people have joined, and of course, from all the countries that were mentioned. The Andean Health Organization is going to continue promoting this topic. We did the first part. Magda, we have an situation analysis on visual health of the 6 countries. This has been completed, and now we have to think in an Andean policy for visual health. We also would like to mention that this needs to be evaluated or implemented through the course of life, because we know that the big problems are the diabetic retinopathy, glaucoma, cataracts, and everything else. So we wanted to start this with children. And also something else that is important, let's not forget that if we didn't do the evaluation of visual acuity in the initial years, it has to be done later. And there are 3 important messages. One is that, yes, we need to evaluate children every 6 months, but not only because myopia may increase, because the first reason for the children don't want to wear glasses, and that has it changed. This is a positive message. It seems to be a cool idea to wear glasses. So many children are using glasses. So we need to follow that marketing trend so kids use their glasses. And the other issue is the retinoblastoma, the most important, most frequent tumors, which is not easy to do early detection. But we can help with the red eye reflex, and that's the third message. Look for this red reflex, must be mandatory in newborns. So it's not has to do with ophthalmologists or optometrists. It also involves pediatricians and teachers, nurses, health professionals, and not only the health sector, but also the education sector. Thank you very much. We will see you next Thursday at 11 a.m. local time. with the webinar on polio,
una amenaza latente.
a latent threat. Thank you very much. Bolivia, Colombia, Chile, Ecuador, Peru, and Venezuela. Together we're stronger. Together we reach further. See you. Bye. Thank you.